I'll call the meeting to order. The Fitch-Rona EMS Commission meeting is called to order, 7:01. Roll call, we can kind of do just by looking at the participants, I guess, unless you want to call it, Patrick.
Nope, but I'll just go down the list. So I don't see Shannon, but I do see JR, and I see Connie. I see Kate. Do not see Greg. I see Derek's screen. Can you hear us, Derek?
I can. I'm calling in. I'm still working on video capabilities, but I'm calling in.
Sure, perfect. Glad to have you. Mike, I see. Terry, I see, and I know Sue said she's out west, so she is excused. Greg did reach out to me saying he's still trying to figure this technology thing out. I said if Mike can figure it out, then Greg should be able to figure it out, but...
Oh, no, my wife.
Yeah, Mike, I saw your wife set it up.
Oh, yeah. It's not me.
Well, and
don't give me that much credit.
Well, it looks like Greg may be joining us there, whether he can speak or not. We'll see. Are you able to hear us, Greg? There he is. Sort of connecting to audio. Give him another minute here to spool that up. Can you hear us, Greg?
I can now.
Perfect. Welcome.
Welcome.
Glad you got connected. So yeah, it looks like we got a quorum. Thanks, Terry.
Okay. Did we get any public comments?
I'm gonna do a quick check of the email here because they have right up until 6:59 to submit a request, and I don't see anything. So nope.
Okay. Everybody get a chance to review the minutes from June 18th?
I did.
I noticed the minutes are getting much longer.
This one should be a short one.
Well, I was going to say probably because of the video recording, maybe, right?
Yeah, so I can go back and actually remember what we said.
Yeah. Well, anybody have any corrections?
No.
No.
A motion to approve?
I'll make a
Mike
motion to
moves
approve.
approve.
I'll second.
Your mic.
All in favor?
Aye.
Aye.
Is anybody opposed? Hearing none, the minutes from June 18th are approved as submitted.
All right, let me grab out the Chiefs report for you to take a look at then.
Wow, I see mountains. Oh, there you go.
There you go. Dreaming of cooler, fancier places. So everyone can see the Chiefs report.
Yep.
Yep.
All right, perfect. So this is for July. So we were spot on for calls in June of last month. So 291 and 219 or 2019 and 291 in 2020. So it was a 0% kind of a net that zeroed out for last month, but that still gives us an overall 6% for the year. We can go kind of through what we're seeing here. It's still kind of just coming. I mean, it's the nature of, as I've always explained, the nature of our business here was we had a couple of really slow weeks, low volume, and then the last week of June just picked up, and it was running some crazy stuff. Seeing a couple of COVID patients a week, kind of as Mike alluded to earlier. Had one actually in the fairly recent past. We took them in from a motor vehicle accident, and they're testing all the patients coming through for COVID. That patient actually was a COVID. And it had previously actually tested positive for COVID, and we actually picked them up for a motor vehicle accident. So we are still taking precautions on every single patient we pick up. As Mike said, if you go to the Dane County Public Health website, Dane County Emergency Management, CDC, they're putting all the numbers out there. We still have weekly meetings with Dane County Emergency Management, EMS, and Public Health. That's kind of just giving us the statistics. So very much still community spread. So taking all those precautions. As far as our PPE goes, we got that really great donation back in March. We actually gave some of that to the county to kind of help share the wealth around there. Looked at our burn rate for a few weeks out, and we knew we were sitting pretty good for 8 to 10 months in hopes that this was going to get a little better after 8 to 10 months. We're spot on, 4 months into this, and our burn rate's pretty accurate. So we're actually sitting pretty good for about another 4 months. But already starting to put some feelers out there to see what we can get. So there's still a pretty good lag time in masks. we're using reusable gowns so that it's absolutely sustainable. When we can get some extra gloves, I kind of throw some extra gloves in there, things like alcohol preps, surgical masks. Surgical masks are available, but they are 10 times the price of what they were. They were 7 to 10 cents a mask. They're upwards of $1 a mask now. It's just the cost of doing business in these times, but they are available. Same thing, N95s we are using. We do have a reusable decontamination process. We're using the state's system. There's a decontamination site set up over by the Wisconsin National Guard headquarters, so we are sending those in. That's my quick update on where we're sitting at with PPE. We're doing okay, but we're gonna probably in about 4 months here, gonna have to start purchasing some stuff. So I think we'll do okay. We've got some of that COVID funding, and I can start kind of tracking some of that. We have to use up what we got first before I can apply for some more. So I'm just going to start plotting that out, and I'll just keep you informed of how we're doing with that. That's the calls in a nutshell. We're headed for 3665. Should this trend continue, we plan on 3600. So we're right where we probably were planning on. Runs by municipality, just good information for you. It's right on where it always has been. Most of it up in the city of Fitchburg. I think the town of Verona dropped a little bit last month. We had a couple of crazy days in Verona in June, just like all of the calls came in Verona. Don't know why, just the stars were aligned that way. Fractal times, we're actually still sitting pretty good on those, averaging 9 calls a day. The July consortium, we actually started a new triennium. Well, it used to be a biennium. All EMS licenses expired in June of the even number of years. They passed some state legislation last year that to make that from a 2-year to a 3-year renewal. I'll just reserve my comments on that decision. But it reset a whole bunch of other stuff, and to me made it a little more complicated. They just kind of made the rule without a really good map to get there. But we've been working with our consortium group. So July started a brand new triennium now. So everybody has to start keeping track of new continuing education. Essentially, we start over at the front of the book on all the topics that are required over the next 3 years. So it was actually infection control. So it was a pretty good topic area for us. Next week, Friday, we'll be doing our biennium. Every 2 years, we have all of our staff go through the emergency driving course. So I actually need to follow up with Epic, but we're going to use the back parking lot of Epic. Just a gigantic parking lot. Dane County will come help us set that up. It's a cone course. It's all slow movements. It is a timed course, but it's a forward serpentine, back serpentine, docking station box. So it's essentially turning, moving, and trying not to knock over cones. So we'll actually do that next week, Friday, and then just working on some more airway management stuff for us. It's a pretty good topic for us to just continue to review. Something we need to be proficient at. We actually did have one of a contracted event go on this month. The horse team driving competition out off of Riverside Road in the town of Verona, which we've had every year. They reached out to us. They did it this year. They were able to do it with some social distancing. So we actually did send an ambulance out there. Just the other statistics for you there, the calls, days of the week, hours of the day. And you can actually see Verona picked up just a little bit last month. So Fitchburg actually dropped down to that 57%. Top 70 reasons calls and sick person just flip-flopped. As I've mentioned in previous months, cardiac arrest made its way back onto the top 10 reasons this month. Working again with our senior centers and public health to try to get out there that just because we really want people to stay out of the healthcare system, they can't wait when they're having chest pain or stroke symptoms. So they're staying at home, and unfortunately it's turning into being too late. So cardiac arrest, and that's county-wide, is actually that cardiac arrest count is up. Calls by station, you'll actually see, as I mentioned, Verona actually took a really big jump last month. I don't know what happened, something in the water out there. As far as our financials go, our aging report sitting right where we should be. They just did a kind of a purge. Every few months he does a purge of those accounts that are considered truly uncollectible. We send them off to the collection agency. That's a Stark agency we use in Madison. Now they take a higher percent. I think they take, depending on the length of how long they've had it, they take 33% of what they collect. But as far as our billing company and us look at, those are truly uncollectible calls for us. We've worked on those for 6 months. So we kind of write them off. So anything we get then is great. because they have the resources then to dig a little bit deeper. They start filing the tax interception forms. They start digging deeper. So that's why we see that 180 day call down to 0, because that just got rid of a bunch of calls. Those ones that are over 180 days, I actually have a list of those. Those end up being sent with some weird calls that are either sitting. A lot of them are court cases, like motor vehicle accidents, that they're just taking a really long time to get resolved. We have patients who actually make payments. And they end up with a $1,000 bill, and they're just making $10 a month payments. And as long as they're making a payment, we just continue to collect $10 a month. So that's why there's kind of $13,000 and some weird stuff sitting out there. As far as our cash on hand goes, you'll see it's a little less than where we were last year. It has a lot to do with the timing of when we get our municipal money. So we're still sitting okay. I will share that there's the CDs that we see there this month. I did actually have to, they actually came due next week, Friday anyways, but the timing of the municipal money this month didn't time well. Remember, if we used to have this really big reserve, we moved all that because we were getting a better interest rate from the Whisk investment company. That used to all sit in our money market. Because it's not in our money market, it would say it's not really there to play with anymore. So I did have to cash 2 CDs in so that we could make payroll this month. And of course, the day I cashed those CDs in, the very next day, I got 2 checks from our municipalities. So what I'll just actually, once we get all 3 municipalities in for the second part of the year, we'll actually put some of that money back into a CD for 6 months. So you'll see that change a little bit next month. Otherwise, all of that is where we should be. The biggest change there is payroll. You'll see the biggest the decrease in the savings account. The savings account is where our FAP money sits and our donation money sits. So that has to pay for some of the bills for the rehab trailer that I was showing you last month. And then some of the video tablets that I mentioned last month that we used our FAP funding for, that state assistance fund. So that's where you'll see that savings account went down, just about to the same amount that you'll see down here where our FAP funds went down. Otherwise, with the phenomenal investment that's going on out there, our post-retirement healthcare made a whole $52 in interest. I think that's kind of pretty par what everybody expected. No donations for this month. And celebrating Gary, this will be 19 years for Gary. Gary was actually hired 6 months after I did, so we're kind of hanging in there together. Just because I took my leave of absence and went to the school for 5 years, Gary does like to remind me he's got more seniority than I would have had if I stuck around. But so Gary's got 19 years in, and then Andrew Jensen, who's been with us full time now for 3 years, 4 years as an LPE. So congratulations to both of them. We actually have, I think it's 4 people hitting 20 years next year. So we got actually a very, I'm just going to call them an experienced workforce. There's our comparables I just mentioned of those last month that we looked at the beginning of the year. A couple other notes I just have to share with you as far as the Chiefs report. One of the full-timers that we hired in the 7 full-timers that we hired from last year did not make his probation. I actually kind of worked with him on some issues we were having over the last year. Came to just kind of a good time to part ways. So he actually resigned from us about a month ago. We actually did an LT, went to our LT pool. I got letters of interest from them along with an updated resume. Jeff and I did interviews with them 2 weeks ago. We actually did try to bring in Mitch, who's the HR representative from the city of Fitch-Rona. Fortunately, the morning of our interviews, something came up with the city and he was unable to sit on that interview panel with us. So it ended up just being Jeff and I. We actually had 12 of our LTEs. We have 18 LTEs. So we had over half of them apply for that open position. Interviewed them, did some reference checks on them, and hired one, did a job offer to one of them just this last Monday. So Ryan Robertson, he's actually one of our brand new LTs within the last couple of months. We actually stole him away from Wanakee, and Dells Delton is the history where he comes from. So he'll be a phenomenal asset for us. When we all start getting back together, we will do a formal opinion with him. But he lives up in Dane, runs with Dane Fire. He said volunteered in Wanakee for years, just got hired there full time, but now he's full time with us. So, well, congratulations to Ryan. And then just a quick update on the Alliant Energy Center. Got that contract signed and sent it off to the county. I'm still waiting to get back from Joe Parisi the signed contract. So as far as I know, things are still moving forward. There is some kind of active, I think I shared last month, some active discussions with the town of Madison and the city of Madison about fire and EMS services. That's kind of, I guess it was public meetings with the town board last week. They're essentially the city of Madison is, the town of Madison is looking at contracting out fire and EMS services to the city. It's much more complicated than I need to share right now. If you got some questions, I can share that with you offline. We're not involved in any of those negotiations. Those are happening way above our heads. Both the mayor and the city administrator of Fitchburg are aware of those discussions that are going on. They are asking the input of myself and Overmacher, but I don't know that it's going to really influence this setup with the Alliant Energy Center. I had this conversation with Chief Davis before any of this was even happening. But just kind of wanted to give you an update that is signed on our side and waiting for Executive Breezy to sign that. That's all I have for a Chief's report, unless anybody's got questions.
You broke up just a little bit in there on me. So we did get the Alliant Energy Center contract?
I'm waiting for it to be signed.
Okay, that's what I needed to say.
Yep.
Okay.
And I can't submit anything to the state office until I have that signed contract. So it hasn't gone to the state yet either.
Any other questions? Otherwise, we'll move on. I'm assuming there's no chair's report, so we'll skip that and move on to review and approval of the 2021 operating budget, which was presented last month, right?
Correct. That is exactly what we presented to you last month. I shared with you, I copied over some of the 2020 numbers incorrectly. So those were fixed, but it didn't change anything that I proposed in the 2021 budget, short of I think it was a little bit more of a savings versus an increase. But otherwise, yeah, unless anybody came up with any questions since they saw this last month, it's exactly what you saw. We just didn't get to vote on it because I didn't have it on the agenda to vote on it.
Are there any questions? If none, why don't we go ahead and proceed with the vote? All in favor of approving the 2021 operating budget as submitted by Chief Anderson?
Do we need motions first?
Oh, yes. And can we have a motion?
I'll make the motion.
And a second?
I'll second.
All in favor?
Aye.
Aye.
And anybody opposed? Hearing none, the 2021 operating budget as submitted is approved.
Perfect. That is due to Fitchburg, I think, in the 26th. I was really just waiting for tonight to happen. I've got the forms all filled out to send up to Fitchburg, so they'll see that. They've already kind of seen a little bit of a preliminary one, but I'll fill out the official form and get that to the 3 municipalities now next week, so they'll have that number to work from.
Okay, and then you want to move on to the fee schedule for next year, right?
Yeah, so this will take effect in 2021. Historically, you can look at it here. We raised it in 26. I only went back to 2016. That's all I could actually really find. 2016 and 2017, they raised it $50. And then we actually left it at that for 2 years, from 17 to 19. We raised it to $1,100 in 2019. So this will be 2 years that we've left it at that rate. I sent this out in a little bit of a different format just to kind of give you the information and see what other municipalities charge. This is probably a little bit easier format to see. So this is 2019 rates. So here's what we charge at Fitch-Rona. This is Middleton, Sun Prairie. I brought in Deer Grove, they're another paramedic service in Dane County. So it's comparable as far as another paramedic service in Dane County. Their volume is not nearly what our volume is, but they're kind of a 2.5 ambulance-ish, or I'm sorry, like a 1.5 ambulance service. They run about a 1.5 ambulance. Sometimes they have a second truck in service. Sun Prairie is kind of 2.5. They've got their full-time 2, and then a third one when they can staff it. Middleton, it's always 2. So our true comparables are about Middleton and Sun Prairie, but I don't want to put Deer Grove on there as a reference for you. We have two different base rates, $1,100 for a resident, $1,200 for a non-resident. The history behind the difference is that residents pay taxes. So residents are already kind of subsidizing the service that they're getting. So that's why we have that non-resident rate that's a little bit higher. We just haven't upped mileage for Medicare most of the time. I don't know what the current Medicare cap is, but they will just pay what they pay. And last I knew it was $22. That's why we didn't raise it up. Now private private insurers, which is about, off the top of my head, it's about 60% of our payers. They will pay what we charge to the extent of sometimes they have their own caps like allowables, in which case then the rest of it goes over to the patient to charge. Our no transport fee, we're doing $150. There's a little bit of a difference in there. If we just went to a scene, we did an assessment, we didn't really do anything and left, it's $150 just for the mere service. Usually in the handful of cases, like a diabetic, we'll get on scene, start an IV, give them some sugar, treat them, leave them with a responsible party. Same thing with a respiratory distress, we give them a treatment, we leave them with a responsible party, or say a cardiac arrest where we actually run the gamut of medications and drugs and we leave, but it's unsuccessful. We tend not to transport them because it's an attempt in futility. We get medical direction and safety of everybody. We just leave them there. It's actually a $450 charge plus whatever supplies we would have used. Our standby events, we do $12 to $50 mobilization fee. That kind of just covers because our crews are there about a half an hour ahead of time, covers the gas, kind of covers the wear and tear, and then it's $100 an hour for an ambulance of two. So you can see what other municipalities charged last year. All of them are higher than what we charge. So I guess my question to you is, or if you want my recommendation, is we raise our rates, at least our resident and our non-resident rate, probably by $100 each. I don't know if you wanted this do $50 each, kind of. I also am very bothered. I also don't want to continue to contribute to the rising cost of healthcare by us just continuing to raise our rates. But as you can see, comparables to us, everybody else is at least $100 more than we are. Any thoughts on at least a base rate?
I'm fine with raising resident, non-resident by 100.
Any other discussion?
I'd agree with that.
Does anybody know what insurance covers on this?
It all depends on what insurance you have. If you have medical assistance, it pays about $110. If you have Medicare, it pays about $350. If you have Dean Care, it pays the whole. It all depends on your plan. Some people have deductibles, some people have copays. Really, really good insurance pays all of it. Motor vehicle accidents insurance, they will pay all of it. That's why we like to get our bills in quick, especially auto accidents, because auto accidents pay up to whatever, $1,500, and whoever gets their bill first gets paid.
How many patients that we see don't have insurance?
I probably should have pulled that number for you.
Any idea? Is it significant?
It's not significant, but it is. I always try not to think of it as a consideration, but it is a consideration. I get probably one or two. They come in waves, but I get probably about a dozen a year hardship requests. We do have a policy to review them. Most of the time, again, I follow the policy, but most of the time I take the approach if somebody took the time to write me a letter that said, I can't pay this because XYZ reason, they can't pay it. So we actually
make an adjustment then.
Yeah, so usually one of two ways. If somebody says, I'm living in a house with my family and I work 3 jobs and I really can't pay this, most of the time I will write it off. If there's somebody who said, I really can't pay this bill, it's really high, but I'm willing to make payments, what I do then, and this is for the policy, reduce that down to what if they would have had medical assistance, and then I actually try to say, here's the contact information for medical assistance. You need to go reach out to them. If you truly can't afford health insurance, you need to get some health insurance. But I'll reduce their bill to what medical assistants would have paid, which is most cases about $150, $200. So it's something versus me trying to collect $1,500 from somebody who's making $10 an hour and trying to support a family, and all I'm going to do is continue to spur that hole down into something they're never going to get out of. So,
Well, it seems to me the number is fairly small then. I'm comfortable with what you're proposing. In fact, might want to even go a little higher.
and that's what I guess I'm asking all of what your thoughts are.
I mean, it seems we're significantly below what the other comparables are charging, and we might get more insurance money. I mean, I kind of agree with you. I hate to feed the
Right.
medical costs, but this is actually just recovering, not even recovering our actual cost, is it?
For the most part, no. No, that's why we're still asking municipalities for 50% of our budget.
Yeah, so I'd be comfortable with even going up $200 more on each of them. I don't know how everybody else feels. I'll go with what the group is comfortable with.
I like it going up $100 on each one. That's my opinion.
I agree with that. I would rather see it just be 100 increase rather than more.
Yeah, I agree.
Okay.
Yeah.
Sounds good.
Okay.
I make a motion, we go up $100 for residents and non-residents to $1,200 and $1,300 respectively.
My thought is let's do them all first, and then you can just make one big motion at the end if you're okay with that.
Okay.
So mileage has been $22. Middleton does do 23. Most everybody does 22. So I don't know if you want to just leave that the same. I believe medical assistance caps it at $22, which means we're just going to add more to our write-off.
Let's leave that. My opinion is leave it.
Yep, I'm fine with that.
Yeah, $22.
The no transport fee, I'm still actually really okay with that $150. That seems to be one of the more controversial charges we have. We do have some kind of guideline. I mean, we have guidelines in place. If we do, it really comes down to, for the most part, if our crews take a set of vital signs, it counts as something we did, and those patients get charged. So that's even somebody walking through Farm and Fleet, right, and they pass out, and somebody else calls 911, and we get there, and they're like, "I'm fine. I was just lightheaded." We take a set of vital signs on them as a provider, as we should. Really, they're fine. I don't want to go. Okay, send them off. They get a $150 bill. Most of them email or call saying, "You didn't do anything for me. I didn't call you." It happens on car accidents a lot. Now, if we don't, car accidents, we go up and, "Hey, my name is Patrick. Are you hurt?" And they say no. We keep walking. They don't get a bill. Even if like, "All right, I just need you to sign this because I really think we need to look at you, right? You got a big hole in your head." And they say, "Don't touch me, keep on walking." And even if we get their data, but we don't ever touch them, they don't get a bill. So it's really only if we do something, but I get a lot of, right, my kid got in the face by a baseball bat. I didn't call you and you charged me $150. Right, we called, we're there. If something would have been wrong, I'm pretty sure you'd have been happy that we came. So this is one that's up to you. Now, Middleton, it's $450.
Middleton.
And I bet Steve gets a lot of these calls as well, and he charges 4 times what I charge.
That's a lot.
Yeah, wow. I think the 150 is fine.
Okay.
Yeah, I agree.
Okay. So I would agree with you as well. And also, we also have a service to pay for. So this is why I bring them up. The only other thing I would ask to review, and I brought this up last month, is our standbys. So we do that $50 flat fee, and then we do $100 an hour after that. You see Middleton if anybody got connection with Middleton, right? It's expensive to call an ambulance in Middleton, but they provide good care as well. My suggestion is we take this up to $130 an hour, or $65 a medic.
That's what we're doing with the Alliant Energy Center, correct?
Correct. That is what I told them as far as a schedule. We are currently charging essentially $50 per paramedic, and we roll out 2 of them. So that's a bike team or an ambulance. So it turns into $100 an hour because of the $50 an hour. So that number was, we looked at Jeff and I probably looked at it about 1.5 years ago to make sure that that was truly covering 100% of our costs. What's that?
When was the last time you would change the, or how long has it been that rate for the standby?
Forever, as far as I can remember. So, I mean, that's been at least 4 years when I came back here. I think that's what it's always been. We look at what it costs for salary and benefits of the middle of the road paramedic. $50 an hour covers that cost. If I send Gary, who's got 19 years on here, we lose a little bit of money. If I get an LTE that I'm only paying $19 an hour and no benefits to, we actually make a little bit of money. So it all averages out to about that $50 an hour. So my suggestion was, and JR kind of brought this up last month, right? There's wear and tear in the truck. Sometimes it's going to sit there and idle for 8 hours. I'm paying Gary more. We're bringing in LTEs more, and they're here for half an hour before and usually half an hour afterwards. I think $65 would actually help offset the budget as a whole, and I still don't think is out of the realms of a service that we provide. If we weren't there and they had to call Ryan Brothers, they'd be paying significantly.
I agree with that.
Is that $65 for the setup, or do you want to increase the hourly rate too?
So I guess I would stick with the $50 setup fee, and then I would do the hourly rate up to $130. Or probably the motion should say $65 per medic, because we try to, for the most part, we work in a group of 2. But it's not, especially and now I'm kind of looking at the Alliant Energy Center, if they don't want an ambulance, but it's Alan Jackson and they need 5 paramedics to walk around the Alliant Energy Center. Now I'm ending up paying kind of per medic per hour, and I think that's the better rate. So essentially it's $65 an hour per medic, or $130 an hour for the ambulance, which is 2 people.
Sounds good to me.
Yeah, I don't have a problem with that.
Sounds
Okay.
good.
Second, third, fourth, whatever.
So I guess if you want to phrase it all in a motion, Terry, this will be effective January 1st of 2021.
Okay, is there a motion to approve the rates for 2021 as presented by Chief Anderson?
Mike approves.
Second.
All in favor, signify by saying aye.
Aye.
Any opposed? Hearing none, the rates as presented for standby events is approved for 2021, starting effective with January 1st, right?
January 1st of 2021, correct. And I'll make sure that all gets typed up in the minutes. And then I was on in 2019 or the 2018 for the 2019. I completely missed it. That's why we started in February. So we're far enough ahead now. I'll type all of that up in the minutes. So make sure when you look at the minutes next month that you make sure I got it right. I'm pretty sure I did. I think I remember 4 numbers, but you know me in math. So make sure you take a look at that next month.
Okay, anybody have any other business?
It'd be a short meeting for us.
If not, I would entertain a motion to adjourn.
So moved.
A second?
Second.
All in favor of adjourning, signify by saying aye.
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 Any opposed? Hearing none, the meeting is adjourned.
My guess is we're still gonna probably continue to do this for the